Hello, I'm Jane Burwood, the Vice President of Surgical Services at UNC Rex. We welcome you to our hospital. Rex Surgical Services is here to devote time to you and your family, both before and after surgery. Even though our crucial work is done in the operating room, we're here for you throughout the process. At UNC Rex, we're proud to serve you as the leading surgery provider in Wake County. We have made a significant investment in our people, our process, and our surroundings to ensure that your surgical experience exceeds your expectations and that you and your family feel both comfortable and well cared for. We're also very proud that for 11 consecutive years, Wake County residents have voted us as their preferred hospital in the largest consumer survey in the country. We don't take this trust for granted, and we continue to make sure we are a top hospital for safety and quality care. We understand you have choices in healthcare, and on behalf of all of us, thank you for choosing UNC Rex Healthcare.
You've been scheduled for surgery and have been going through all the paperwork and preparations to get ready. It's only human to be a little nervous when undergoing any kind of surgical procedure. At UNC Rex Healthcare, we want you to have the best possible treatment and experience while in our care. We've put this video together to answer any final questions and help put your mind at ease. Prior to surgery, your surgeon's office may schedule you for a pre-testing appointment, or you may receive a pre-call to obtain medical information and give you brief instructions. Depending upon the type of surgery you're having, you may have lab work, diagnostic tests, and may even meet with an anesthesiologist. Here's a quick checklist of additional things to remember as you prepare. If you experience changes in your health prior to your procedure, let your surgeon know as soon as possible. Things to bring: photo ID, any prescription medicines, insurance information, and if copay is applicable, a form of payment. For your safety, a responsible adult 18 or older must accompany you. To promote the quiet and restful recovery of all of our patients, children under the age of 12 are not permitted in the recovery area. If the patient is a minor, we recommend 2 adults accompany the patient, one to drive and one to care. Wear loose, comfortable clothing. Please remove all jewelry, piercings, and leave all valuables at home. Do not apply any deodorant, makeup, body oils, or lotion. Please remove any nail polish the morning of your procedure. Make sure you know the location of your surgery, where to check in, and the time you need to be at the hospital. If you need directions when you arrive at the hospital, please ask any of our staff or volunteers to assist you. On the day of surgery, it is important that you arrive on time. Your arrival time was scheduled to allow enough time to prepare for your procedure and also allow for any last-minute tests your surgeon or anesthesiologist may order. Please understand that each and every patient at UNC Rex is given the time and attention necessary to ensure proper preparation and a safe procedure. Surgery and waiting times are not exact. We will let you know as soon as possible if an unexpected event causes a delay, postponement, or cancellation of your surgery. Encourage your friends and family members that come with you to bring something to read, a book, magazine, or tablet while waiting. UNC Rex does have free Wi-Fi. Let them know it can be a little chilly in the hospital, so bring a jacket or sweater just in case. Also, your friends and family members can hold on to any personal items that you may have brought with you. Once you're settled in your room after surgery, they can bring your things to you. Hospital staff and volunteers can answer questions they may have. When you check in for surgery, you will receive identification bracelets, and your family members will receive a tracking card. You will be directed to our waiting area until you are called. For your privacy and the privacy of others, initially only the patient will be escorted to our pre-op area, where you will need to change into a hospital gown. You will also have to remove any eyeglasses, contact lenses, or possibly dentures before your surgery. Remember when we asked you to remove colored polish from your nails? Well, that's because staff will check your nail beds during surgery to monitor oxygenation. Once you are settled, usually about 30 minutes, we will reunite you with your family or friends. Your safety is our highest priority. While you are being prepared for surgery, our staff will review your health history and perform safety checks. Your armband will be checked multiple times. They will ask various questions. What is your name? What is your date of birth? What procedure are you having? They may seem like very simple questions and the repetition may get tiring, but these questions play an important role in our safety checklist. In addition to your safety, we want you to be as comfortable as possible. You'll be on a surgical stretcher, which allows us to move you safely throughout your surgical process. Warm blankets and additional pillows are all available for your comfort, and a call bell will be within reach at all times. We are here to help. You and a variety of different disciplines make up your healthcare team. Your team will be in constant communication, both with you and with each other, to keep informed of your progress. We go above and beyond national standards for infection prevention at UNC Rex Healthcare. Clean hands are one of the easiest and most effective ways to prevent the spread of disease and infection. Your healthcare team will perform frequent hand hygiene before entering and exiting your room. Please ask your family members or friends to do the same. UNC Rex Healthcare uses a robust bedside computer charting system to document the course of your stay with us. You'll see nurses and other healthcare providers using this computer system to perform documentation. Each and every medication ordered for you is checked by an in-house pharmacist. Your nurse will scan your armband prior to each medication administered, providing yet another safety measure to ensure you receive your prescribed medication. Nurses will start IVs for fluids and administer any medications your doctor may have ordered. Members of your OR team will meet with you and answer any additional questions you may have prior to heading to surgery. At this point, any friends or family that may be with you will be directed to one of our waiting rooms. Once you go into the operating room, friends and family will be able to monitor your progress through our patient tracking system in the waiting room. The tracking card received at check-in contains a number that allows your family to follow your progress. This is how we protect your privacy while keeping your loved ones informed. As you enter the operating room, you will see a lot of busy people wearing masks and surgical gowns. This is your surgical team. In addition to your surgeon and anesthesiologist, there will be surgical techs and nurses who will perform a variety of tasks during your procedure. Since it may be cold in the surgical suite, one of the first things you'll be offered is a warm blanket. If you have any questions or concerns, please feel free to ask any of your team. They are here for you. When your procedure is over, you will be moved to the recovery area. Your healthcare team will work with you to manage your pain and nausea throughout your stay. UNC Rex uses a 0 to 10 scale in order to measure your pain. Your family will be informed within 30 minutes of your arrival to the recovery room and given updates as necessary. Visitation is limited, but it is our goal to reunite you with your family as soon as possible. If you are going home the same day as your procedure, your nurse will review with you and your family any discharge instructions for your home care. We offer concierge pharmacy service to fill your prescriptions before you leave. If you had any form of anesthesia during your surgery, you must be accompanied by a responsible adult upon discharge. If you are staying in the hospital after your procedure, our team of healthcare professionals will do everything possible to make your stay a safe and comfortable one. Please don't hesitate to ask if there is anything we can do for you. Your surgeon will advise you when you can resume normal activities and when you can return to work. Make sure you understand any restrictions or limitations that you may have. If you go home the same day as your procedure, a member of our nursing staff will call you to see how you're doing. If you have any questions about your post-operative care after you're home, please contact your surgeon's office. Make sure you are signed up for your My UNC chart, where you can check any test results, communicate with your provider, manage your appointments, and more from the comfort of your own home.
I'm Joel Ray, Chief Nursing Officer and Vice President of Patient Care Services here at UNC Rex Healthcare. Our team's single focus is providing care for you and your family. We want to provide the very best in patient care and service. I'm proud that our team has been selected not once, not twice, but 3 times by the American Nurses Credentialing Center as a magnet organization. What does this mean to you? This means that you and your family are being cared for by the top nurses in the country. Remember that you're an important part of the healthcare team. We want you to feel comfortable in asking any questions that you may have during your stay. If there's any way that we can make you more comfortable or address any concerns, please ask to speak to one of our charge nurses or clinical managers that will always be happy to address your needs. Our goal is to provide you excellent, high-quality care. Our top priorities are your safety, recovery, and comfort. Thank you for choosing UNC Rex Healthcare.